Welcome to the Omni Dental Podcast.
Right. So if you think about it, right now, the fillings in your mouth are surviving an environment that is honestly more hostile than a car engine.
Yeah, they really are. I mean, they're enduring thousands of pounds of pressure, extreme temperature swings, like going straight from your hot morning coffee to ice water and this constant corrosive acid bath.
Exactly. And despite what you've probably been told, they are quietly ticking toward an expiration date.
Which is exactly why we're doing this today.
Yeah.
We are opening up a stack of notes from Omni Dental of Arlington Heights, focusing specifically on this really insightful July 2026 article by Dr. Belis Pols.
It's a great piece.
It really is. Our mission for this deep dive is to figure out what your teeth are desperately trying to tell you. We're looking at the hidden signs that you need a new dental filling.
And we really operate under a very dangerous misconception when it comes to dental work, you know?
How so?
Well, most of us view getting a filling as this permanent one-and-done situation. You sit in the chair, the dentist does the drill and fill, and you just mentally cross that tooth off your worry list for the rest of your natural life.
Yeah, guilty as charged. I definitely do that.
Right. But we need to completely reframe that mindset. The human mouth is not some static museum display case.
Far from it.
Exactly. To expect a piece of engineered resin or metal to sit in that biomechanical war zone and just never degrade, I mean, it's ignoring the basic laws of physics and chemistry. Nothing placed in that environment will last forever.
It's funny, we really do treat dentistry differently than any other kind of maintenance in our lives.
Oh, absolutely.
Like, think about the tires on a car or the shingles on a roof. We fully accept that rubber breaks down from the friction of the road, right?
Sure.
And that asphalt shingles eventually warp from the sun and the rain. We know those things have a finite lifespan.
Yeah, it's built into our budget.
Exactly. Yet for some reason, when it comes to a composite resin bonded to our living skeleton, we expect total immortality.
It's a massive psychological blind spot. But the clinical data in our source material strips that illusion away pretty instantly.
Yeah, those numbers were eye-opening.
Right. The materials used in modern dentistry, I mean, they are marvels of science, but their lifespans are highly finite.
So what are we actually looking at, timeline-wise?
Well, tooth-colored composite fillings, the ones that are incredibly popular because they seamlessly blend into your natural tooth, they generally have a functional lifespan of about 5 to 7 years.
Wow, just 5 to 7 years.
Yeah. Now, traditional amalgam fillings, those are the silver-colored ones made from a mixture of metals. They are more durable mechanically. Those can hold up for 10 to 15 years.
Okay, I want to look at those numbers critically for a second on behalf of everyone listening.
Sure, go for it.
Let's say I pull up my medical records, and I realize I just hit the 8-year mark on a tooth-colored composite filling.
Okay, past the expiration date.
Right. But structurally, my mouth feels completely fine. I mean, I'm crunching on ice cubes, I'm drinking hot soup, and I feel absolutely zero pain.
Right.
It just seems counterintuitive to go seeking medical intervention when my body isn't sending any distress signals. Should I be panicking here?
Well, hitting that timeline doesn't mean you need to panic or demand emergency surgery right this second. But the lack of obvious pain, that is a terrible metric for oral health.
Really?
Yeah.
Even if it feels totally fine?
Yes. Crossing that 5 to 7 year threshold means that material is actively degrading at a microscopic level, whether you feel it or not.
So what's actually happening under the hood?
It's about the margins. Those are the microscopic borders where the filling material is bonded to your natural tooth structure.
Yeah.
They're subjected to hydrolysis.
Hydrolysis.
Yeah. It basically means the water in your saliva is slowly dissolving that bond, so the seal might be compromised in ways entirely invisible to the naked eye.
Oh, wow.
Think of it like a hydroelectric dam with a microscopic hairline fracture.
Okay.
The village in the valley below feels perfectly safe, no one is panicking, but the structural engineer knows a catastrophic failure is brewing, and an inspection is long overdue.
That is a terrifying analogy, but it makes total sense. So we have to transition away from just relying on a calendar date or waiting for agonizing pain.
Exactly. You have to start paying attention to the subtle physical mechanics of the mouth.
Right. Because if we can't trust our memory of when we got the filling, and we can't wait for a toothache, what is the progression of a failing filling? Like, how does our mouth actually communicate this breakdown to us?
Well, Dr. Pohl's article outlines 5 distinct red flags. And what makes this so fascinating is that each sign points to a completely different mechanism of failure.
Okay, let's break those down. Where does it start?
We can trace the life cycle of a failing filling, starting with the mechanical architecture of the tooth. One of the primary signs is a sharp pain, specifically when you bite down.
Let's look at the physics of that. Intuitively, yeah, pain means something is wrong. But how does the simple act of chewing trigger that specific alarm?
It really comes down to structural integrity and forced distribution.
Like weight bearing.
Yes, a healthy intact filling acts like a custom-fit shock absorber. When you bite down, it absorbs the immense force of your jaw muscles, which is a lot of force, by the way,
Right.
and it distributes that pressure evenly across the root structure of the tooth.
Okay, so what happens when it fails?
Well, if that filling material has microfractures, or if the constant chewing has caused it to shift even a fraction of a millimeter, it loses that ability to distribute weight.
Ah, I see.
So when you bite down, that mechanical pressure is suddenly driven straight down into one highly concentrated area. It often presses directly into the underlying dentin layer and the nerve.
Right.
Yeah, that sharp, stabbing pain. That's your nervous system alerting you that the architectural foundation of the tooth is fundamentally compromised.
That brings up a critical point about the underlying anatomy, actually.
Hmm?
And I think that connects to the next warning sign in the text, which is sensitivity to hot, cold, or sugary foods.
It absolutely connects.
Now, to play devil's advocate here, almost everyone experiences a random sizing when biting into ice cream sometimes. A brief twinge doesn't necessarily mean a filling is failing, does it?
No, you're right. The source draws a very specific line in the sand here. Occasional fleeting sensitivity is super common. It can be caused by something as simple as brushing a little too hard that morning.
Right, just irritating the gum line.
Exactly. The true red flag here is lingering sensitivity.
Lingering.
Yes. If you take a sip of your morning coffee and that throbbing discomfort hangs around for 10 or 15 seconds after you've swallowed, the protective seal around your filling has fundamentally failed.
Wait, let's explore that tooth anatomy you mentioned a second ago. If the seal fails, why does temperature cause pain? I mean, is the inside of the tooth not just solid bone?
That is the crucial detail that surprises a lot of people.
Yeah.
Your tooth is built in layers.
Okay.
The outer shell is enamel, which is incredibly hard and protective. But underneath that is the dentin. And dentin is not solid bone. It's actually porous.
Porous, like a sponge.
Yeah, somewhat like a microscopic sponge. It is packed with thousands of tiny fluid-filled channels called tubules, and they run directly from the outer enamel down to the living nerve pulp in the very center of the tooth.
So it's essentially a bundle of microscopic fiber optic cables transmitting environmental changes straight to the nervous system.
That is the perfect analogy. When a filling seal breaks down, you lose the insulation over those cables.
Oh, that sounds awful.
It is. Those hot, cold, or highly acidic irritants bypass your outer defenses and travel straight down those fiber optic tubules. The fluid inside the tubules expands or contracts from the temperature, and that triggers the nerve instantly.
So that lingering pain means the barrier is totally gone. The door is wide open?
Exactly. Which leads us to the physical breakdown of the material itself. The text points out visible cracks or chips as the third sign.
This seems like the most obvious visual cue, right? If you look in the mirror and a chunk of the composite is missing, or there's a visible fissure running through the center of the tooth, the material has clearly succumbed to fatigue.
You'd think so, but honestly, you would be shocked by how often patients notice a chipped filling, run their tongue over it, realize it doesn't actively hurt yet, and just decide to ignore it.
Just ignore it. Why?
They treat it like a purely cosmetic issue. Like, oh, it's just a little chip, no big deal.
Right, because the nerve isn't screaming yet.
Exactly. But a cracked filling is an open door for bacteria. And that leads directly into what I consider the most dangerous and sneaky red flag outlined in the notes.
Which is the dark edges or deep staining around the perimeter of the filling.
Yes.
I can totally see why people ignore that one too. I mean, if you drink a lot of black tea or coffee, you just assume you have a surface stain. You think you need a whitening strip, not a dental drill.
It absolutely masquerades as a cosmetic annoyance. But when you see a dark outline tracing the edge of a filling, it usually points to a phenomenon called microleakage.
Microleakage. That sounds bad.
It's terrible. This happens when the chemical bond between the filling and the natural tooth completely degrades. It creates a microscopic trench between the two.
And what gets in there?
Food particles and bacteria. They get packed into that trench, and they create this highly acidic, anaerobic environment right against the vulnerable part of the tooth.
So if a cavity forms under the filling in that trench, the filling is actually doing more harm than good at that point, isn't it?
How do you mean?
Well, it's essentially acting like a protective roof for the bacteria. It's hiding the decay from my toothbrush bristles.
You've hit the nail on the head. The tooth is rotting from the inside out, shielded by the very medical device that was supposed to protect it.
That is incredibly unsettling.
Yeah, the surface looks intact, but the foundation underneath is literally dissolving.
Okay, looking at the final red flag from the source, it focuses on the topography of the tooth. It says if your floss keeps snagging or shredding in one specific spot, your filling might be failing.
This is a really common one.
I'll admit, my first thought here is that shredding floss is just a sign of bad flossing technique, or maybe, just buying cheap, poorly made floss from the grocery store.
Right, we always want to blame the tool first.
Naturally.
But if we look at the mechanics, a freshly placed, healthy filling is sculpted by the dentist to be perfectly flush with the natural, smooth contours of your enamel.
Okay, so it should be a seamless transition.
Exactly. But over several years, as that filling degrades, or if it chips or shifts under all that chewing pressure, it changes the physical landscape of the mouth.
So it moves out of place.
Yes. It can create what we call an overhang, or it can leave a physical, jagged gap between the teeth.
So it fundamentally alters the architecture of the space between your teeth.
Yeah.
Your floss is snagging because it is physically catching on a microscopic ledge of worn-out resin.
Precisely. And the danger here is that where floss catches, food catches.
It's a trap.
It is a permanent trap for debris. No matter how meticulously you brush or floss, you cannot effectively clean a jagged overhang. It becomes this localized breeding ground for bacteria, constantly irritating the gums and driving decay deeper into the tooth.
Which really brings us back to human nature. When something is subtly annoying but not agonizing, like a snagging piece of floss or a fleeting shadow on a tooth, we tend to put it off. We gamble.
We do. We wait until it hurts.
And the source material addresses this directly through a very common patient FAQ. The question is literally, can I just wait 2 years to fill a cavity?
And waiting it out is the single biggest gamble you can take with your health. The answer in the text is a definitive, absolute no.
Because of how fast things escalate.
Because of what we call the cascade effect. A small dental issue in a warm, moist, bacteria-rich environment like the mouth never stays small.
Because you've breached the barrier, and the bacteria now has unrestricted access to that porous dentin layer we talked about earlier.
Exactly. The bacteria burrows deeper and deeper into the soft dentin, fueled by the sugars in your diet. And because this is all happening invisibly under the old filling, you might not feel it until the bacteria finally hits the inner pulp chamber.
Where the nerve lives.
Right. And at that point, the infection can actually spread into the jawbone itself.
So by waiting 2 years, the stakes escalate from a minor repair to major surgery.
Exponentially so. Look, if you catch microleakage early, a dentist can just pop out the old material, clean the area, and place a new filling in less than an hour. It's easy.
And if you wait?
If you wait, that simple cavity hollows out the tooth from the inside. You might suddenly need a dental crown to physically hold the remaining fragile tooth structure together.
Or worse.
Or worse. If the nerve is infected, you are looking at a root canal. That involves drilling into the center of the tooth, removing the infected nerve entirely, and sealing the hollow canals. You are basically trading an easy tune-up for a massive, expensive structural intervention.
I think a huge driver of that procrastination isn't just a fear of the drill or the cost. I think it is a profound sense of shame.
Oh, absolutely.
People avoid the dentist because they feel like they have somehow failed. There's another fascinating FAQ in the source that asks, how many fillings are normal at 30?
It's such a vulnerable question.
It really is. People are terrified they are uniquely bad at taking care of themselves,
It's a question rooted in completely unnecessary guilt. And the source provides a wonderfully clinical and reassuring answer. There is no universal normal.
Oh, no.
None. A patient with 0 fillings at age 30 and a patient with 6 fillings at age 30 can both have perfectly healthy, well-maintained mouths. Oral health is an incredibly complex matrix.
So it's not just a scorecard of how well you brush and floss.
Not at all. Your susceptibility to cavities is heavily influenced by genetics. Some people naturally develop softer, more porous enamel from birth.
Just bad luck of the draw.
Essentially, yeah. It's also influenced by the specific pH balance of your saliva, your childhood exposure to fluoride, your diet, and the unique microbiome of bacteria living in your specific mouth.
Oh, that makes a lot of sense.
Right. Someone with impeccable brushing habits can still get cavities just because their saliva naturally leans a bit acidic. The metric should never be comparing your filling count to a societal average. It should solely be about maintaining the structural integrity of the teeth you have right now.
Shame really is the enemy of action. So let's pivot to the solution. This is exactly why the approach to dentistry has had to evolve.
It had to change.
Yeah. When Dr. Bayless Poles and the team at Omni Dental of Arlington Heights put together these notes, their main focus wasn't just on the mechanical act of drilling and filling. It was on how to manage the anxiety and catch these issues before they become crises.
That preventative approach is everything.
Right. So if a listener is hearing this realizing, hey, my morning coffee has been making me wince for weeks, what does the fix actually look like?
The process of replacing a filling is highly streamlined and surprisingly quick nowadays.
Walk us through it.
Well, the dentist uses specialized tools to gently remove the old degraded composite or amalgam. Then, they meticulously inspect the underlying dentin to check for any of that hidden cascade effect decay we discussed.
Making sure there's no microleakage damage.
Exactly. They thoroughly clean and sterilize the cavity, prepare the surface, and bond a brand new, perfectly fitted filling into place. In most scenarios, patients walk out and are eating their normal diet within just a few hours.
And what really stands out in the source material is Omni Dental's strict policy on no surprises.
Yes, that is a big deal.
Because the ultimate fear is going in for a 30-minute filling replacement and waking up in the chair to find out you were getting a root canal and a massive bill.
Nobody wants that. That transparency is central to modern, patient-focused care. The source guarantees that if the dentist removes the old filling and discovers that the invisible decay has spread significantly deeper than the initial x-rays showed, they immediately pause.
They don't just keep drilling.
No. They sit you up, they show you exactly what they found, and they discuss the updated treatment options before taking another step. You are completely in the driver's seat regarding your own medical care.
That kind of ethical partnership really changes the entire dynamic of going to the dentist. And this brings us to the experts who provided today's insights. Omni Dental of Arlington Heights, located at 305 E Rand Road, is positioned as a premier destination for catching and correcting these exact microfailures.
They really are, and Dr. Bayless Poles brings over a decade of highly specialized experience to the practice.
That's a lot of time in the trenches.
Definitely. His background is heavily rooted in treating complex dental injuries and emergencies with incredible precision. But beyond the impressive resume, what truly defines the practice and the documentation is their integration of cutting-edge diagnostic technology.
Which is vital, right?
Yeah.
Because if we're looking for microscopic fractures and visible microleakage, the human eye just isn't going to cut it anymore.
Exactly. Advanced technology isn't just about having a shiny office. It means radically better clinical accuracy.
Like what kind of tech?
It means utilizing digital imaging and diagnostic lasers that can spot the microscopic chemical breakdown of a filling long before it ever reaches the nerve. It translates to highly efficient treatments and fundamentally enhanced comfort in the chair.
And they are eco-friendly too, right?
Yes. Furthermore, they operate as an environmentally conscious practice. They utilize sustainable materials and protocols that minimize their environmental footprint without ever compromising patient safety.
And their reach is massive. It's not just Arlington Heights. Their service footprint covers a huge swath of the area, including Buffalo Grove, Palatine, Mount Prospect, Rolling Meadows, Schaumburg, Wheeling, Des Plaines, and Elk Grove Village.
They cover a lot of ground.
They do.
Right.
And while we spent this deep dive heavily focused on the microscopic world of failing fillings, their scope of practice is incredibly comprehensive.
It goes way beyond just fillings.
Right. They manage everything from general dentistry and deep periodontal cleanings to advanced reconstructive and aesthetic treatments. We are talking Invisalign, clear aligners, professional teeth whitening, all-on-4 dental implants for total smile restoration, and even custom-fitted sleep apnea appliances.
It operates as a true hub for complete oral health. They are capable of guiding a patient from basic preventative diagnostics all the way through highly complex cosmetic transformations.
So we have covered some serious ground today, from the fluid dynamics of our teeth to the chemistry of failing resin. Let's distill the core takeaways for the listener.
Sounds good.
First, dental fillings are incredible feats of engineering, but they have an expiration date 5 to 7 years for composite, 10 to 15 for amalgam.
Don't forget that.
Second, your mouth will give you physical warning signs when that seal is degrading. Pay attention if your floss starts snagging on a jagged edge, if you feel a sharp pain concentrating force when you bite down, if you notice a dark trench forming at the border of a filling, or if you have a lingering sensitivity to temperature that just won't fade.
And the overarching lesson here. Catching those microscopic failures early is the difference between a simple, affordable tune-up and a major structural dental crisis.
The cascade effect.
Yes. Do not let the quiet, invisible progression of bacteria trade a minor cavity for a root canal.
So if you are listening to this and realizing you are actively experiencing any of those 5 red flags, or if you just know you've pushed past the lifespan of your current dental work, do not gamble by waiting it out. Reach out to the highly skilled team at Omni Dental of Arlington Heights.
Definitely reach out.
You can call their office directly at 847-483-8833, or you can easily visit their website to book an appointment online. Get ahead of the problem today.
I want to leave you with a slightly bigger philosophical concept to mull over before we go.
Lay it on us.
Well, we've spent this time discussing how we erroneously treat our teeth like they are static, permanent stones, when in reality, the mouth is a dynamic, highly volatile ecosystem under constant biomechanical stress. We learned that even a scientifically engineered, chemically bonded medical device has a finite lifespan and will eventually, inevitably, lose its seal if it isn't monitored.
Nothing lasts forever.
Exactly. It makes you wonder if something as solid as a resin filling is slowly degrading under the immense pressures of daily life, what other permanent fixes in your health, your daily routines, or even your personal boundaries might silently be losing their seal right now.
Wow.
What else in the ecosystem of your life is quietly degrading, just waiting for you to check on it before it cascades into a much bigger problem?
Now that is a profound thought to chew on. Thanks for joining us on this deep dive. Take care of your teeth, take care of yourselves, and we will catch you next time.